My patients are like family to me. If they came in with a serious back problem, I usually referred them to a surgeon. But not anymore.
Welcome to the VaxD Physicians Network. VaxD therapy is the non-surgical solution to serious low back problems. "85% of us will suffer from serious low back pain at some time in our lives. For people under the age of 45, back pain is the major cause of disability and lost time from work. In fact, it is the second most common ailment seen by general practice physicians each year, and it is the #1 healthcare expense in the United States, costing $80 billion annually. If low back pain is making your life miserable, vertebral axial decompression may be the answer. VaxD is a non-surgical therapy developed for the treatment of serious low back pain. This breakthrough technology was invented by Dr. Alan Dyer, former Deputy Minister of Health of Ontario, Canada. Dr. Dyer is also known for the development of the heart defibrillator. VaxD therapy uses FDA-approved technology along with clinically proven principles to relieve pressure on vital structures of the spine, including the discs and spinal nerves. It is not just aimed at treating symptoms, but is designed to alleviate the underlying problems that cause low back pain. In a structure as intricate as the spine, a lot can go wrong. The spine is made up of a series of bones called vertebrae, each cushioned by a soft, shock-absorbing disc. Probably the single most troublesome portion of our back is the lumbar spine, or lower back area. It is usually the area of the spine which receives the most stress and strain. As a result, more spinal problems occur in the lumbar region than anywhere else.
I hurt myself doing the simple thing of moving a 44-pound case. I'm in air transportation, and the simple fact of trying to move that popped a disc in my back. It's funny how something as simple as and as small as that can change your life. It hurt. It hurt. Felt like somebody was sticking an ice pick in my back. It drove me actually to my knees. I went to the doctor, and he took x-rays. Couldn't find anything wrong. Figured it was a muscle or mechanical type problem. So they recommended some rest and some physical therapy. But when the pain didn't go away and there was nothing on x-rays that showed there was a problem, I had an MRI. The MRI showed that I had a protruding disc at the L4, L5 level. That was causing problems with leg pains shooting down my left leg. What was unfortunate also about it is that I'm the safety manager at my job, so I had the dubious distinction of being able to put my own name in the OSHA log. I got a lot of ribbing from my friends on that, as did my coworkers. I went through physical therapy, and that was supposed to work as far as pain management, but the pain didn't go away. It kept on aggravating and being there. I couldn't sit comfortably. I couldn't stand comfortably. I couldn't lay down comfortably. As a matter of fact, I spent 10 weeks sleeping on the floor with my knees elevated to give myself relief from the pain. I finally heard about VaxD, which is a simple non-operative procedure. I decided to do some homework, go look into the procedure, and through the procedure, I actually went through it. My company approved getting the procedure done. I went through it, and the pain went away. It was amazing. I was an active person. I played tennis. I do a lot of yard work, and I went from that to being like an 87-year-old hobbled man. I couldn't even lift my briefcase. Once I went through the procedure, the pain was gone. I'm able to run and jump, play tennis again. My wife's happy because I can do yard work again. And a follow-up MRI showed that there was no indication of any type of trauma whatsoever. The disc is back in place, and it doesn't even look like I was injured. I'm healthy. I have no pain. I'm playing 4 hours of tennis 3 times a week. I'm back to normal. It's amazing.
By virtue of their training, Doctors want to help a patient who is suffering. Until recently, however, most available options in the treatment of serious back pain have been limited and failed at treating the underlying causes associated with disc and joint problems. It can be frustrating to doctors when they cannot relieve a patient's pain. Too often, back surgery is considered as the next step, simply because a doctor thinks it is the only alternative. CBS News reported that in the United States alone, there are 80,000 unnecessary back surgeries done each year. But surgery has its own drawbacks.
Back surgery should not be entered into lightly. Besides hospitalization and the recovery time that you must go through, you also have the risk of general anesthesia. In addition, problems can arise from infection, scarring, and its associated complications. The surgery may also produce a general loss of mobility. An even larger consideration is that many times the surgery just doesn't work, or if it does work, it often only offers temporary relief. You see, when you surgically change one disc, you can actually put additional pressure on the disc above and below it, which can lead to future back problems, sometimes even another surgery.
VAX-D has been the subject of several clinical studies and has been written up in the Journal of Neurosurgery. Most recently, an independent study of more than 900 patients treated with VAX-D therapy was published by the Medical Technologies Group. Overall, VAX-D was shown to be successful in nearly 8 out of every 10 cases, including patients suffering from single and multiple herniations, degenerative disc disease, and Facet syndrome. Due to this remarkable success rate, VAX-D has had its share of media attention in the United States and in Canada. VAX-D therapy requires no hospitalization or anesthesia. This simple procedure consists of a series of 15 to 20 treatments scheduled at your convenience. You begin each 30-minute treatment by lying comfortably on the patented VAX-D table with your lower back fitted with an adjustable nylon harness. Simple hand grips connect the upper body to the table and allow you the immediate freedom to release and end the therapy session at any time. The table slowly divides under computer-controlled and monitored conditions, gradually relieving pressure and decompressing the affected discs and joints.
VAX-D literally takes the pressure off your discs and spinal nerves. As you lie on the table, the pressure within the disc in your back is measured at 75 millimeters of mercury positive. The VAX-D therapy reduces intradiscal pressure to as low as 150 to 200 millimeters of mercury negative, which creates a vacuum within the disc. Now, simply put, this reduction in pressure allows the back to help heal itself in 2 major ways. First, it creates a vacuum-like state in the disc that helps retract the nucleus. This retraction, in turn, helps to allow the outer layers of the disc to get back into position and begin to mend. Just like a broken bone has the ability to mend itself, the outer layers of the disc can mend themselves once the pressure is taken off the disc and nerves. This is an MRI of a patient with a ruptured disc. The spinal cord and nerves show up as the white column. You can see the rupture, which shows up as the dark circle, putting pressure on the nerve. After treatment with VAX-D therapy, we have a follow-up MRI that was taken in the same area. Now, as you can see, the ruptured disc has retracted and the pressure on the nerves has been removed. Prior to VAX-D therapy, this just wasn't possible.
If you suffer from low back pain caused by a herniated or degenerative disc, there is new hope. With VAX-D therapy, there is no hospitalization, no surgery, no fear, and simply no reason to suffer anymore.
Thank you again for your interest in the VAX-D therapy. We hope you call today and make an appointment with one of our network physicians. You'll be glad you did.